Okay, we are going to talk about hysterectomy. We know hysterectomy is a procedure that involves removal of the uterus. Yeah, we know the uterus can be removed for various reasons. Somebody can have fibroids, they can have endometriosis, they can have adenomyosis, they can have cervical cancer, they can have endometrial cancer, they can have genital prolapse, this usually in elderly women. They can have abdominal vaginal bleeding or abnormal vaginal bleeding. These are like gynecological indications. In obstetrics, usually you have ruptured uterus as an indication. You might have atonic uterus. That woman is bleeding and that uterus needs to be removed. So a hysterectomy can be simple, meaning that only the uterus and the cervix is removed, or it can be a total abdominal hysterectomy with BSO as well. So this means that total abdominal hysterectomy and BSO means that apart from removing the cervix and the uterus or the body of the uterus, means the tubes and the ovaries are removed as well. So that is called the TAR plus BSO, meaning total abdominal hysterectomy plus BSO. You can also have, apart from having a total abdominal hysterectomy, you can also have a subtotal hysterectomy. So subtotal hysterectomy means that you remove the body of the uterus, but you retain the cervix. So the cervix remains. So when the cervix remains but the body of the uterus is removed, we call that subtotal hysterectomy. A subtotal hysterectomy can be done for various reasons. Sometimes when you have a ruptured uterus or atonic uterus, these are like obstetric emergencies. The patient is pouring, they're bleeding. You want to do a procedure that is quick and gets the patient off the table, off the theater table as fast as possible. So those are the situations we usually do a subtotal hysterectomy. In gynecology, sometimes you have a difficult procedure, even like a total abdominal hysterectomy. You want to do a total abdominal hysterectomy, but you find that the adhesions, bowel is adhered to the cervical area, and so on. Bladder is adhered to the cervical area. And then you decide that it will be more dangerous to go on with the procedure. So you do a subtotal hysterectomy in those gynecological situations. Yeah, so when somebody has a subtotal hysterectomy, what we need to remember is that the bleeding, the monthly bleeding, the periods continue, because usually there's this small amount of endometrial tissue that is left there. So the patient might experience spotting. Some of them might experience just bleeding. So we need to make the patient aware of that. And if a patient has had a subtotal hysterectomy, the other thing they need to be aware of is that the cervical cancer screening needs to continue, because the cervix is still there and the risk for cervical cancer is still there. So cervical cancer screening needs to continue, as opposed to the patient who had a total abdominal hysterectomy. So a patient who has a total abdominal hysterectomy does not really need to continue cervical cancer screening because the whole cervix is out, the whole uterus is out. It's only those patients who had a total abdominal hysterectomy and the reason was related to cervical cancer. Those patients need to continue with cervical cancer screening. The advantage of having a subtotal hysterectomy, apart from the fact that it's easy for the surgeon, is that the supports of the uterus are not cut out, and therefore the risk of pelvic floor prolapse is reduced. And then there are people who believe that the cervix is part of the reasons that sexual pleasure is there. So if the cervix is removed, there's reduced sexual pleasure. But this has not been supported by any research or science, but there's belief that the cervix is involved in sexual pleasure. So sometimes some patients would ask if their cervix can be retained during these procedures. Then the other type of hysterectomy that you are going to see is called radical hysterectomy. Radical hysterectomy means that apart from just removing the uterus and the cervix, more things are removed. So the adnexia is removed. This is the tissue around the uterus. The supports of the uterus can be removed as well. You know, the uterosacral ligaments. The cardinal ligaments. All those supports of the uterus can also be removed. The other thing that makes a uterus radical is that part of the vagina can be removed. And the other thing is the amount of dissection that is needed. So there's a lot of dissection needed to isolate the ureter so that the tissue around the uterus is removed properly. Sometimes there's need to even cut the ureter and you put it back in the bladder to just allow a lot of dissection and a lot of removal of tissues around the uterus. This is usually done in cases of cervical cancer and so on, when you have a malignancy and you need to do surgery for the malignancy. So that is a radical hysterectomy. Hysterectomies sometimes in brief can also be divided by just the route of removal. So a hysterectomy can be vaginal when it was removed through the vagina. It can be abdominal when it was removed through the abdominal cavity or abdominal opening. It can be removed robotically and it can be removed laparoscopically as well. Yeah, complications of hysterectomies, we know it's bleeding, the usual, infection, damage to visceral organs, which we've talked about, bladder, ureter, bowel, all those things can happen. Then the final bit of the discussion is really counseling. This is important, counseling patients who have had a hysterectomy. What things do we talk about? What things should we talk about? So the first thing is that they will not be able to become pregnant because the uterus is removed. They don't need contraception. Second is that they will not have menses. That monthly bleeding will stop. If they had the subtotal hysterectomy, you need to explain that they might have some spotting because a bit of endometrial tissue has been left behind. Number 3, you need to tell the patient that they need to continue with cervical cancer screening. If they had the subtotal hysterectomy, if they had the total abdominal hysterectomy, they don't need to continue with cervical cancer screening. What they need to, the only patients with total abdominal hysterectomy that need to continue with cervical cancer screening are those that had hysterectomy because of cervical cancer. So they will continue with what are called VOT smears. Yeah, so those are the things, pregnancy, menses, and then lastly, you need to talk about 2 things. One is menses. Is it menopause? Not menses, menopause. That the menopause will come earlier in these patients who have the hysterectomy, usually 2 to 4 years earlier than normal, because blood supply to the ovaries gets impaired when the hysterectomy is done. Then lastly, that their sex life will not be affected in any way, because there's no research that has found that sex gets affected in any way when they have a hysterectomy. They can start having sex as soon as they feel well again. So that was briefly about hysterectomy. All you need to do now is go to the theater. We do about 2 to 4 cases every day. Just go to theater and have a look at the steps for hysterectomy, how the procedure is done. You can come to theater and have a look at that. So thank you. Those are the next steps for you.